Okay, so the next presenter is for Dr. Maya Stenari for neuromodulation in medically complex patients. And is this video? Okay, very good.
Hi, I'm Dr. Maya Stenari. I'm one of the pediatric epileptologists at CHOC. I'm very excited to treat complex kids with either genetic epilepsies or neurometabolic disorders. I'm going to give you a short talk today about neuromodulation in medically complex patients. We'll talk a little bit about what are our options when medications fail when your child is diagnosed with epilepsy. I'm going to tell you some details about neuromodulation, and I'm going to concentrate on one of the types of neuromodulation we use as treatment called vagus nerve stimulation. The goals of care when we diagnose your child with epilepsy is the first goal is to stop all the seizures. But at times when brain is very irritated, especially with some progressive neurodegenerative diseases, that is not a realistic goal. Then we have to change our goals to eliminate the number of seizures, reduce the intensity of seizures. One of the big goals of care with medically complex patients is limiting the side effect of the treatment that you're giving. Improve the recovery period after a seizure, and then obviously improve the quality of life. We want to make sure that our kids have the best time when they're up and about, so they can enjoy their school, therapy time, and playtime, and family, of course. We know that when we choose a medication for seizures, even though it's the right medicine for the seizure type, we're successful in only about 60% of the time. So then we are adding a second anti-seizure medication, but our success rate drops down to about 10 or 15% more. And then adding the third or fourth or sixth or 11th medication, it doesn't mean that eventually we'll reach that 100% seizure freedom. It's very highly unlikely that by trying another anti-seizure medication, we find that space. So that is the time when you come and see an epilepsy specialist. And we'll go over evaluation if there's any either types of diets we could use, or if there's a surgical procedure we could do to help either cure the epilepsy or reduce the seizure burden. Neuromodulation is type of epilepsy surgery we use in our refractory cases when there's nothing focal we can resect. Typically the disease is diffuse, affecting the whole brain. So those are typically the types when we start considering if neuromodulation would be a good option for the child. So what is neuromodulation? What do we mean when we talk about neuromodulation? The goal with neuromodulation is altering the activity of neurons by delivering a targeted electrical stimulus to a specific neurosite in the body. There are two big types of systems. We talk about open loop system, a vagal nerve stimulator, or deep brain stimulator are some options that work with open loop system. And then there's a closed loop system The only device currently available in the market is responsive neurostimulator system. And what's the difference between those two systems is open loop is the device is kind of giving the stimulus throughout the day and night at particular time periods. It doesn't look at if your child is having a seizure or not. It's just kind of giving the stimulus throughout the day, and that over time will cool off the irritable brain activity. Closed loop system is actually detecting the seizure activity and then delivering the treatment only when the seizure has been detected. Any of these neuromodulation modalities, they're very effective treatment options for medication-resistant epilepsy. Actually, vagal nerve stimulator was FDA approved in late 1990s already, and it's approved for ages 4 and up. And there has been already thousands of kids who've had a vagal nerve stimulator placed. So it's found to be very safe and effective treatment modality. RNS system is one of the newest neuromodulation options we have available. It's currently not FDA approved yet for pediatric patients, but throughout the U.S. there are several centers, including CHOC, who have implanted these devices on kids, and the results have been very exciting. So where does a vagal nerve stimulator go? There's a battery that goes on the chest, left on the chest wall under the skin, and there's a cuff that's threaded around the vagus nerve on the left side, and everything is under the skin, so nothing's visible. Nothing is outside of the skin. Left side is typically chosen because more of the nerve fibers regulating the heart rhythm is on the right side, so it's thought to be safer to place the VNS device on the left side. So how does it work? We don't fully know how the device is effective, but the theory behind it is that the device sends an electrical impulse through the vagus nerve, and that travels up to the brainstem through the thalami, and that's a relay center through the cortical structures. And then over time, as the stimulus goes up and up, it calms down the irritated brain and the epileptic activity and seizure activity. The nice thing about a VNS therapy is it does its job throughout the day and night. The device steadily treats the irritable brain day in and day out. There's nothing that you have to do as a parent, or there's nothing that the child needs to do in order the device to work. The device is doing its job throughout 24-hour period of time. The newest model has some exciting features. So this is the model we're placing for all of our kids who are deemed to be VNS candidates. There are setting options for day and night. So I can choose the setting options depending on what time of the day the patient typically has seizures, or if there are different types of seizures at different times of day. There is also a detection system in the VNS device. It kind of monitors the heart rate throughout the day, and compares the current heart rate to the previous 30-60 seconds. If there's a sort of peak elevation of the heart rate, the device gives an extra stimulus. And there's also an option for parent or patient swiping a magnet over the VNS device and activating a stimulus. That way we know that the sooner we catch the seizure and give that impulse through the system, the better the outcome for treating seizures. Unfortunately, there's not a good study showing effectiveness of VNS therapy on GM1 patients, but I pulled two other larger studies for kids with refractory epilepsy syndromes. One is Lennox-Gastaut syndrome, and the other one is in kids with Dravet syndrome. And if you remember, I was telling you about the effectiveness of adding more and more medications. The further along we go, the less likely it is that we find the one that shows significant effect on seizure burden. But vagal nerve stimulator has been shown to be beneficial, significant seizure reduction in at least 50% of these really refractory cases of epilepsy. So that's very exciting when you've gone through a few medications and seizures still continue. There are still other options we can. There's a stepwise system how we increase the settings, and then we can alter the settings depending on the type of seizures your child is having. The most common side effects that we see is changes in the voice. Sometimes it can cause coughing or drooling or difficulty swallowing, but we can alter the settings to minimize these side effects. And obviously, more rare side effects, including side infections, have been reported. This is a very short glimpse on other than medication treatment options. I'd be happy to talk more about the non-medication treatment options with you. I hope you enjoyed the conference. Have a good day. Thank you. Bye.